Joe Biden campaigned on ending the pandemic. Now, 1 year into his presidency, the pandemic is rolling into its third year.
The president is really succeeding on the global response through direct commitments from the United States to countries in need in terms of doses, in terms of dollars, in terms of cooperation.
What hasn't happened, says one campaign's Tom Hart, is bigger buy-in from Biden's counterparts.
Where they are not yet succeeding is providing the leadership to gather other countries together in a unified campaign to end the pandemic. What's happening is wealthy countries are making individual commitments and they sound good, but the parts are not adding up to the whole.
As COVID cases skyrocketed due to the Omicron variant, January marked the first time that polls showed more Americans disapproving of Biden's handling of the pandemic.
I think the Biden administration overall has done well when it put its mind to it. So I think they get an A minus, B plus. However, the issue is oftentimes some of their policies have over-relied on vaccine-only approach.
Epidemiologist Eric Feigl-Ding says the Biden administration could have done more to combat misinformation and to ensure that emergency funding for schools upgraded ventilation systems. He faults the Biden administration for not providing home COVID tests and N95 masks for free or at cost after the president recently announced an insurance-based reimbursement program.
Altogether, this is a pandemic of political leadership as well as the virus, as well as human behavior and politics around the human behavior. So the Biden administration is not in control of every aspect of those, especially the misinformation. But this is all the more important, and it reveals that the pandemic is not just solely a biological phenomenon. It is an information phenomenon.
Critics say the Biden administration must do more on the global stage as well as at home to get more vaccines to more people and convince the vaccine hesitant to come on board. Arash Arabasadi, VOA News.
No, I don't think COVID is here to stay. That having COVID in the environment